Thank you very much, Alessandra, for your excellent moderation and support for this important event. So I wear some different hats, and one of them is WHO. So on behalf of WHO we also point to the importance of collaboration. And the WHO Europe region consists, of course, of the EU, but also the Central Asia, Russian-speaking countries. And also there, we share challenges. So we have a lot of commonalities, but also differences. But we see in the challenges we face in general in healthcare workforce challenges with person-centered, how to organize person-centered care, how to organize and build systems which are sustainable financially, where we can offer the best quality of treatment with the newest type of solutions, is for all the countries in their own respect a challenge always. And there are always new challenges like resources, and we have discussed already many topics. So it's important for us and for WHO that we try to stimulate this collaboration. And often we have these sort of good practices and international examples of excellent type of care. But also we know that in these centers or countries who are performing relatively well, they also struggling with the sustainability of their systems. So it's not only about looking at the old traditional sort of examples on how to do it, but thinking on how, if we look to the future from our own context, how we can build affordable and good system, including good quality cancer care. I think also the previous speakers talk about the many different elements, the ingredients in order to make successful cancer care a reality. It's about how do we organize these services. Of course, it's important what kind of products, pharmaceuticals, technology should be in place, what kind of governance works well in a country, what will be a sort of fitting model for financing and investing in cancer care. So there are many different elements. There's already a lot of examples, knowledge, approaches are available to apply to our own situation to make improvements. But it's not easy. It's not easy to implement and change healthcare. Everybody knows this. From the Western world, the Eastern world, Central Europe, Eastern Europe, Central Asia, we all experience these problems. But we can also make ourselves stronger. And there is the element of collaboration coming in. So transforming cancer care together is about how can we capitalize on collaboration. How can we share experiences? How can we learn from our difficulties and find solutions? In the last 2 years, I worked a lot in Moldova on digitalization, a national strategy for digital health. And information, sharing information, digital health is an element also of better cancer care. If you don't share information, if you don't make information accessible, it's very difficult to collaborate. And we need to collaborate because cancer care is not only happening, as what we heard, in the hospital, but also at primary care. It might be in a rehabilitation center. Often social care is important in the full journey of oncology treatment. So we have to support this, and digitalization is also one of the elements. I'm currently doing work in Georgia, and they're also working on these elements. Elements of Moldova are much better in terms of digitalization than the Netherlands. As the Netherlands, we can learn a lot. about how Moldova has solved some of the issues. So it's not a discussion on, okay, where's the best example or where is the worst situation. We can learn, and I think this is also something which we should realize also for Central Eastern Europe. We can make ourselves stronger. We have to reinvent healthcare, not only in Central and Eastern Europe, but also in Western Europe. Our models are not sustainable. So this points to the point of we should collaborate, we should look at each other and how can we strengthen ourselves. And also Romania, Moldova, Georgia, we can actually create synergies in many of these elements. And also for this is also, so we should collaborate, of course, with our colleagues from the European Commission. European Commission has wonderful programs, instruments, a body of knowledge, a political network to make this true. We should look and reach out with industry, with the private sector. There's a lot of strength, creativity in order to help some of these challenges. So at the policy level, and I suppose a lot of you are acting on the policy level, this is also not very easy because it requires skills to communicate at the international level with the EU, with industry. But there's also the challenge, how do you translate this from a policy level back to the local level in Timisoara or in Cluj-Napoca or in any other countries at the local community level. So that's the challenge for us. How do we act as professionals on these different levels, on these multidimensional sort of challenges, and there's when we can help each other. So I think this event is very important and that you came here for with your interest and support. Thank you very much.